throughout the entire COVID pandemic, we realized that there was such a disproportionate impact of COVID on certain communities within our community. Individuals of minority populations, African American, Latino and Hispanic populations had a much higher incidence both of illness and mortality related to COVID. We also realized that folks that are challenged with socioeconomic factors and other social determinants were impacted by COVID.
We heard about efforts of FQHCs across the state pulling together different teams, and so we reached out to Dr. Garrow, who's on our board, and he said, yeah, let's try and get PHN.
So when we discuss inequities, it is something that affects everyone. I always compare equality and equity. And everybody needs to develop their own definition for what that means to them. But for me, the one that makes sense to me is equality is giving everyone a pair of shoes. Equity is giving everyone a pair of shoes that fit. Now, if we're going to do things equitably, then we need to know everyone on kind of an individual basis. There is not a one-size-fits-all for when it comes to equity.
The overarching goal is to, break down barriers and to, make sure that, healthcare services are available, accessible, and adaptable to the moment. The team has been going out, they're doing a great job meeting with civic groups and other, faith-based organizations, others, and being present, answering questions, helping to navigate individuals to vaccines or testing or other healthcare services in a just, fair, and equitable way.
We talk to people, and when we find that person who's ready to get an appointment, we simply say, okay, where would you like to go? And if they don't know, we can ask them something like, do you have a preference as to what vaccine you get? Where do you live? Do you want it someplace close to you? And we get them an appointment where they're comfortable going at a time that is convenient for them in a place that they will trust.
I think it's been a wonderful partnership. We've really enjoyed working with Primary Health Network. What a jewel in our community to have an FQHC right here in Sharon that can help us address the inequities related to COVID and moving forward other health inequities. So